Well, the real problem that we have, not just in the UK, but in the whole of the world, is that generally speaking, dentists are not trained how to do dental implants when they're undergraduates, when they're at dental school. They're taught about what dental implants are, how to look at problems that might arise, but they're not trained how to actually carry out dental implant placement. So that means every single dentist who gets involved in dental implants, certainly in the UK, has to obtain their training and their education from elsewhere. Now that might be going back to a dental school, to a university, to get an academic qualification. But many people choose instead to go for days or weeks or several months at a time elsewhere, learning with somebody else who's going to teach them how to carry out implants, how to look after them, how to maintain them. So it really is very variable, and one of the problems we have is there is no standard, there's no accepted standard for what should be the implant training of choice. Our regulatory body in dentistry is the General Dental Council, and they've adopted guidelines that advise people who are looking to provide training for implants, and also people who are looking to obtain implant training. They advise people on really what they should be looking for. And the key factor to that is a mentor, somebody who is a more experienced, a more senior clinician who will work with that person hand in hand, looking at what they're doing, at the treatment they're carrying out and the quality that they're achieving when they carry out these treatments. So really my message to the patient would be just to ask questions, to go to the dentist and ask them how many years they've been doing this, how many cases have they done. Is this somebody who's done 10 or 20 cases, or is it somebody who's done hundreds of cases? There's sometimes a lot of emphasis put on qualifications in medicine and dentistry, and I think it's worth appreciating that qualifications don't necessarily mean expertise in an area. And one of the things that people should bear in mind is that some of the most experienced people that we have in the UK won't necessarily have a qualification in implant dentistry, because the qualifications are quite recent. They've come along just a few years ago in some cases, and the people that we're talking about have been practicing implant dentistry for 20 years or more. The other thing to bear in mind is that many of the most experienced people in the UK are already registered specialists with the General Dental Council, and that means that they are a specialist in a certain aspect of dentistry as recognised by the General Dental Council, and part of their training involves implant dentistry. So that doesn't give them a separate qualification, but it just means that they already have a significant area of expertise in implants. So these are things that you need to bear in mind and perhaps look a little bit more closely than you might originally think than just looking at the letters after their name.